West Nile virus is continuing to spread through Indiana's mosquito population, and one person has now tested positive as well. Fox 55's Drew Fry explains what you should know about this disease and how to better protect yourself.
More than a dozen Indiana counties have now found mosquitoes carrying West Nile virus. David Fiess with the Allen County Department of Health says he's all too familiar with these pests.
West Nile virus has become endemic here in Allen County, and what that means is it's always going to be here every summer.
Allen and Steuben County are two of the 17 Hoosier counties to report mosquitoes with West Nile. Neither have had a human case, but Department of Health workers in both counties are trapping bugs to send off for testing and working to reduce mosquito breeding grounds.
It's a very small amount of mosquitoes out there that are carrying the virus, but it's kind of like a needle in the haystack trying to find that one mosquito that might be carrying the virus.
Fiess says it's much harder to catch mosquitoes while they're airborne. So the county is monitoring small areas of standing water where mosquitoes can lay their eggs. He says it takes less than 1/4 of an inch of standing water for the mosquitoes to breed. That's about the depth of a bottle cap. Fiess says only about 19% of people infected develop symptoms like West Nile fever. Roughly 1% of those could face more life-threatening symptoms. But there are ways to better protect yourself. Steuben County's Alicia Walsh recommends wearing insect repellent and long sleeves during dawn and dusk, and avoiding standing water in places where mosquitoes may breed. Fiess says the drier conditions over the past few weeks means fewer mosquitoes will be out and visible, but that doesn't mean they should be ignored.
They're not as aggressive, so you're going to be sitting there on the porch, and that mosquito, it's silent, it comes up, bites you, and then you have that possibility of getting West Nile virus. So no matter time of day, bug repellent should still be worn until that first or second hard frost.
Health officials suggest you reach out to your healthcare provider if you start feeling ill 3 to 15 days after a bite. In Fort Wayne, I'm Drew Fry, Fox 55 News.
Fiess also suggests regularly cleaning out potential breeding grounds you may have in your backyard. That includes gutters, bird baths, and pools.